Welcome to Health and Wellness, where we offer integrated solutions for personal and financial retirement planning for medical professionals. I'm your host, Michael Swartz. Welcome back to the Health and Wellness Podcast. As a bit of foreshadowing, I want to walk you through the upcoming episodes that will be taking place here on Health and Wellness. We'll be walking through the background and content of my upcoming book, Health and Wellness, The Physician's Guide to the Retirement Journey. In this episode, we'll be talking about the background of the book and a bit of the journey that led to the publication and some of the reasons behind why the book exists. Then, in upcoming episodes, we'll walk through the highlights and major talking points of each chapter to give a little preview of what is to come. Then, if you enjoy the content, I'd ask that you go to www.healthwellness.com and pre-order the book. The book is going to be released on January 1st, 2025. And with that, let's talk a bit about why the book was created. We begin our story on January 1st of 2023. Yes, nearly 2 years ago. I was at a marketing event, and the former CEO of Gunderson Health System, Dr. Jeff Thompson, who will be a guest in the future on this podcast, was attending the event as well. I approached Jeff and let him know that I'm a financial planner for medical professionals and asked him what the number one concern is when medical professionals are approaching retirement. And his immediate response was, nobody knows how to do it. Rather than writing a retirement book that focused on the finances, he recommended that I focus on the personal retirement journey first. In his experience, physicians ran into 3 obstacles as they approached the end of their career. The first obstacle that physicians faced when they reached the end of their career was deciding when to retire. He said that one of the greatest challenges of being a physician is having such a large amount of personal identity tied to a career. That is, what do you do for a living? I'm a physician. I'm Dr. So-and-so. It becomes an ingrained part of identity, and this creates a myriad of issues. Having an identity tied closely to the career meant that physicians were hanging on to their careers longer than they could practice effectively, and some were retiring in their early 70s or mid-70s and only retiring after being asked to leave. The second issue was that some physicians retired and immediately asked to come back to their careers. He said you would not believe the number of physicians who retired in their mid-60s, got home, retired for a few months, and then came and asked for their jobs back, or asked for some direction in retirement. Dr. Thompson said he had to kindly inform them that their position had already been filled and there wasn't much he could do for them. And unfortunately, because of his position as the CEO of the healthcare system, he had to dedicate his time, energy, and attention on the physicians still employed in the healthcare system. He would connect them with retired physicians to help bridge that gap, but as the leader of the healthcare organization, his time, energy, and attention had to be spent on carrying that forward, and there wasn't a whole lot that could be done to help the retired physician. Finally, the third obstacle is that so many physicians had a laundry list of things they were retiring from, but very limited number of things to retire to. So think about all the stressors of your job, the environment that you're currently in, whether it's increased pace of patient care, technology, administration. I can think of a number of issues that we've run into with retiring and retired physicians, such as new medical records, longer periods of time before you can get paid time off. So rather than a 30-day notice or a 2-week notice, some healthcare systems have gone to a 90 or 180-day notice before you can take time off. Medical records, the integration of Epic, and the amount of notes that need to be done through electronic systems and the number of clicks it takes just to get a note in. The increased pace of patient care. The list goes on and on. So many physicians know the stressors and issues that they're retiring from, but very few have taken the time or have the time to create a life, a future, and to forecast what retirement will look like to be excited about what they are retiring to. So there you have it, the big 3 issues. Identity tied to career leads to holding on. Not having any structure when you retire leads to coming back. And finally, knowing what you're retiring from, but not what you're retiring to. So after having the conversation with Dr. Thompson, I dove into the issues and statistics that are facing physicians in retirement. Here's what I found. Mental health illnesses are being diagnosed amongst retirees at an accelerating rate. Over 1 in 5 retirees are currently diagnosed with depression alone. Americans between the ages of 55 and 64 exhibit the highest divorce rates in the country, which has doubled since 1990. death rates from drug overdoses have tripled over the past 2 decades for those in the age group of 65 plus, and in the 65 and older population, alcohol-induced deaths rose more than 18% between 2019 and 2020 alone. And finally, the highest suicide rate in America is among those over the age of 65. This led me to create the Health and Wellness book to address 2 major issues. First, how to effectively create a retirement roadmap that creates a solution for the issues that have been facing physicians. How to decouple the identity from the career. How to have something to retire to, not just something to retire from, so that on the day that you retire, you reach retirement with clarity and confidence and hope, so that you don't have to worry about coming back to your career to replace whatever void is created on the day that you retire. Now, retirement grants us an unparalleled control over 2 extremely valuable assets, our time and our money. Having a plan for both your finances and your personal retirement journey will create a seamless transition into retirement, or at least make it as manageable as possible. There's no way to avoid all the challenges that are both unforeseen and foreseeable that retirement journeys present. However, as you know, the best healthcare is preventative medicine. Instead of treating the disease, we take a preventative approach to solving the problems before they become issues we cannot overcome. And we do this in Health and Wellness. So the book that is set to release on January 1st, 2025 will address the 3 challenges that are facing physicians and hopefully create a world where these statistics on retirement can be corrected and brought back to the lowest numbers possible. We don't want to see the divorce, death, and dependency statistics that we see now. And Health and Wellness was created to solve these issues. So I invite you to listen to the upcoming episodes where we cover each of the chapters in a little bit greater detail as we talk about the ideas and concepts and solutions that surround the physician's retirement journey. Thank you for listening to this episode of Health and Wellness. As always, I'm your host, Michael Schwartz, certified financial planner and healthcare peer coaching practitioner. If you're looking for more help or additional resources on your retirement journey, please visit healthwellness.com or send an email to hello@healthwellness.com. We'll see you in the next episode.